For the latest information regarding the COVID-19 pandemic in Cupertino, please visit cupertino.org/coronavirus.
Start by saying Happy New Year. And let me just talk about the purpose of today's press conference. I know that people, first of all, my name is Cindy Chavez. I'm on the Board of Supervisors. I'm president of the Board of Supervisors till next Tuesday. So I'm really delighted to be with all of you to talk today. But the point of today's press conference is to have a conversation with the public about what we're experiencing in the hospitals. And I know that people they don't want to have us wagging our fingers at you, and this is not about new rules. This is really about sharing with you what our healthcare system is experiencing and asking for your leadership and helping us as a community to address it. We know that we're seeing a continued surge, and this is critical right now because the county's busy doing two other things: getting people vaccinated and making sure that we have people continuing to get tests. So we want to continue to ask the community to get tested, and vaccines are beginning to be administered. But today's focus is on our emergency medical system. And you're going to hear today from doctors and our county council just to help everybody navigate through the next few weeks and to better understand what we're experiencing. I first want to say a very sincere thank you to our healthcare personnel. They have been complete heroes. And I'd like to introduce Dr. Ahmad Kamal, Santa Clara County's COVID-19 Director of Health Preparedness. Then Dr. Jeffrey Chen from Santa Clara Valley Medical Center's Emergency Room. Then Daniel Franklin, the EMS Duty Chief of Santa Clara County. And our closer today will be our County Counsel, James Williams. So with that, let me begin by asking Dr. Kamal to come forward.
Thank you, Supervisor Chavez, and good morning, everybody. Our healthcare system continues to be under an enormous amount of strain. Every day in our county, more than 1,000 people are diagnosed with COVID-19, and more than 100 people are admitted to the hospital every single day. This surge has been relentless, and it has not stopped, and it is straining our healthcare system to a breaking point. As of right now, patients are waiting in emergency rooms to be admitted because there are not enough beds for them. As of right now, staff are being pulled from other areas of the hospital to provide care to critically ill patients. This means that other patients who also have needs are having to go without. Hospitals are canceling surgeries. Hospitals are canceling outpatient visits. These all have effects, and we cannot have it continue. We need to all work together to contain the surge and give the hospitals a little bit of breathing room so that they can recover and go on with the other critical tasks that our healthcare delivery needs to do, including vaccinations, including testing, and including outpatient care. We know how to do this. We've done it before. We did it in the spring. It's been a long, hard winter. In many ways, January may be the hardest month for us yet, with the impact of 3 holidays being seen in the hospitals. Please, we're asking everybody, do what you can, wear your masks, wash your hands, socially distance, and avoid large gatherings. And together, we can help these hospitals avoid further strain and avoid our physicians having to make further difficult decisions when it comes to caring for our community. Thank you.
Good morning, everybody. My name is Jeff Chen. I'm the ED Medical Director here at Valley Medical Emergency Department. I'm here today to speak to everybody about what we're experiencing in the emergency department. In the ER, we've been fighting this fight for almost a year now. It hasn't gotten any easier. If anything, it's gotten harder as time has gone on. The staff is fatigued. They are tired. They are drained physically, emotionally, in every way you can possibly imagine. But they continue to stand day in, day out, resolute, to make sure that the highest quality care is rendered to every member of this community who needs it. We're resolved to get this done, but we need everyone's help. The ER is full. Folks are waiting for beds. We are getting really creative with places to see patients, and patients are suffering. COVID is no joke. Folks are struggling to breathe. Folks are gasping for breath. Some folks look like they are drowning while they're sitting there in bed in front of us. And there's a very finite amount we can do to fight this new virus. So everyone likes to call the emergency providers the healthcare heroes, the first line of defense against COVID. Folks, I'm begging everyone to help us out here because we're not the front line. We're the last line. We need everyone's support so that we can continue fighting for and with everyone here. Thank you.
Good morning, Daniel Franklin, EMS Duty Chief for Santa Clara County. As you've heard, our healthcare system is currently inundated with patients. This also includes our 911 system, and how it's impacted us is with the hospitals continuing to fill with patients, we have less beds available in the emergency departments to transition care from our ambulance crews to the hospital staff. This has increased our wait times at our hospitals with our ambulance patient offload. What this means for the public is we've had experienced less ambulances available in our 911 system because they're currently waiting at hospitals. What we are asking the public to help us with is to think about calling 911, and if you do need to call 911, think about whether or not it's an appropriate use of 911 services. Every day we get many calls into our system that are really not 911 life-threatening medical emergencies. Oftentimes these could be handled through an urgent care clinic by contacting your primary care physician and setting up an appointment. And so if you are going to be utilizing 911, we just ask that you think about it and say, okay, is this truly necessary? Or is there another avenue where I could seek care? We want to be able to have ambulances available in our system to handle every life-threatening emergency. We want to be able to take care of those that live, work, and play in our system, but we need the public's help in doing so. As you heard from our healthcare professionals, we need people to mask up. We need people to social distance. We need everyone to come together and help stop the spread. We just want you to be aware that it is also impacting the 911 system. We are going to continue to do everything that we can to help those that need our true life-threatening medical emergencies. So please just help us with stopping the spread and think about whether or not it's truly necessity to call 911 or not. Thank you.
Good morning. My name is James Williams, and I'm the County Counsel for the County of Santa Clara. You heard this morning about the strain that the number of cases and COVID hospitalizations is putting on our entire healthcare delivery system, including our EMS system when you call 911 and need emergency medical care. We are at an unprecedented level of cases and hospitalizations coming out of the Thanksgiving surge. And we are extraordinarily concerned about what might be coming in the next few weeks, cases that we are yet to identify coming out of the holidays and New Year's, and what that might mean for increased hospitalizations a few weeks thereafter, starting from what is already an unprecedented high level of hospitalizations that is putting so much strain on our healthcare system. What does that mean to people like you and me? Well, it's not just a matter of ensuring access to care for people with COVID-19, although that is, of course, very, very important. But we take for granted having access to an ICU bed, having access to a paramedic in an ambulance, having access to whatever care we need walking into an emergency department at a hospital, whether it's a car accident, a heart attack, a stroke, any other thing that might happen to one of our loved ones or ourselves at a moment's notice. We take for granted that we have access to world-class, top-notch care with all of those resources fully available. And unfortunately, right now, although we still have that world-class dedication and professionalism, we have incredible strain on the system. And with that strain, the access to those resources is inherently diminished. As a community, we know what we can do to beat back COVID-19. And as vaccination programs ramp up in the coming weeks and months, we know that the tools that we have that work today, right here and right now, those tools are to stay at home unless you're doing essential business. And when you're out on essential business, to wear your face coverings, maintain social distancing. We know all that, but it's hard. Months and months and months in, it's hard when we're seeking the hope of the vaccinations coming in the coming months. But between now and then, we want to get there together as a community with all of our friends, all of our family, all of our loved ones. And the way we can do that is by doing what we so successfully did in March and over the summer, and once again, beating back this surge in COVID-19 cases and hospitalizations. With that, I'm going to turn it back over to Supervisor Chavez.
Great, thank you. So if there are any questions, we're happy to answer them. If you're watching on Facebook, you can text Beth Willon at 408-660-5174. So are there questions from anyone?
Can you give us an update on what's happening with Kaiser and St. Louis, and are there any other hospitals affected?
Are you talking about in terms of EMS services? I think I'm gonna turn that over to James just to make sure we're accurate about that.
Yeah, so we don't have a new update regarding Kaiser, other than we're continuing our investigation as cases are reported in, and we know that Kaiser is continuing its testing, as I think they've shared that they're doing comprehensive testing as that outbreak continues. It's a really tragic situation. And we do, of course, monitor outbreaks at work sites, including healthcare sites across the county. And look, right now with the level of cases that we have, there are a lot of outbreaks at work sites, including healthcare settings all across the county. There is a very high level of COVID transmission right now in the community. There's never been a higher level. And so we're seeing that certainly true at different healthcare settings, but at every single kind of work site that's open, there's just a large volume of cases.
You're investigating in St. Louis as well?
We are aware of a number of cases at St. Louis. They have a comprehensive testing program, all the county hospitals do, and have for quite some time. And so those do catch cases, and I believe currently we're aware of about 8 cases on the staff there.
Any other cases showing up at all at other hospitals? Or?
I don't have the exact data on that, except to say that there are regularly cases at hospitals, and that's actually one of the reasons why the federal government and the state government have prioritized healthcare workers in phase 1A of vaccination, and we're very pleased that many acute care hospital workers have already received their first dose of the vaccine. Now, it will take time for that to be effective because they need to also get their second dose, and it takes several days after that to reach the level of immunity that's been described in the various studies. But we're on that pathway for that workforce, which is, of course, extremely pivotal at this time when those same systems are under strain.
Can we have someone talk about, paint the picture of what the ICU ER situation looked like pre-Thanksgiving and then the past couple of weeks ramping up? Compare and contrast what it was like from then till now.
As far as the number of cases is concerned, to give you perspective, before Thanksgiving and in October, we were hovering about 4 to 5 cases per 100,000 people, and now we're well above 50. It is 10 times worse than what we had before. This has been a very long pandemic, but January is by far the most challenging month we've had. And the reason we're talking to you today is that awful as it is, it could get worse. And there's no other way to say that. Right now, we haven't been in a situation where there's 2 people gasping for breath and only one of them gets a ventilator. We could get there.
Dr. Kamal, with regard to the Kaiser situation, how unusual was that spike there, and to what extent are other ERs around the county vulnerable, susceptible to the same kind of scenario?
So all the emergency rooms and all the hospitals do have employee testing programs that are mandated at various government levels. But as James said, when you have so much COVID in the community, we are all vulnerable. We're vulnerable if we're in an emergency room, we're vulnerable in the community, we're vulnerable everywhere. So clearly the way to really address these hospital outbreaks is to control COVID in the greater sense and to reduce the transmission that's happening everywhere.
Just a quick follow-up. Does the influx of more and more patients every day, does that also ramp up the risk for health workers at these hospitals?
Absolutely. Exhausted health workers, people who are just rushing from patient to patient, people who are having to rapidly turn over beds. None of this is conducive to having the level of care that we would expect. And as you've heard today, we have amazing healthcare professionals working in world-class hospitals, but every system has its limits. We are pushing that limit right now. And we talk a lot about crisis care and surge care, and even though things like sharing ventilators or rationing ventilators are the extreme example of that, there are levels that are happening now. You're seeing it in people waiting in ambulances for hours. You're seeing it in people sitting in beds and gurneys in emergency rooms who do belong in an ICU bed. So we definitely have a lot of concerns about where we are, and we have great concern about where this could be headed.
The daily case count has.
Yeah, I just want to.
Oh, go ahead, sorry.
Will you be finding the hospitals that are not distributing the vaccines in a timely manner here in Santa Clara County?
The vaccine distribution, sorry?
Yeah. Will you be finding the hospitals that are not distributing the vaccines in a timely manner? Fine.
I think that one of the concerns that I have as a member of the Board of Supervisors is making sure that all of the hospitals and everybody who has access to vaccine is getting that vaccine out as quickly as possible. I think right now our staff and the staffs of the hospitals are working really hard to collaborate. The reason that you heard that term about finding was my concern that if in fact we find a lack of collaboration, that myself and other colleagues on the board are going to be asking our staff to be much more aggressive in ensuring that vaccine gets out using whatever means that are available to us to do so. Right now everybody's doing what they need to be doing. If we get a sense that people aren't getting that vaccine out as quickly as we can, then we're going to be acting, or we'll be asking as a board for the staff to act. Are there any other questions? Because I know Beth has some. Oh, Kit, I'm sorry.
Yes, it seems to me, just from looking at the dashboard, like the daily case count and then the rolling 7-day average seems to be trending down a little bit. Am I crazy when I see that? And what do you attribute that to? Do you think that is just holiday sort of break time and the testing, or are we seeing some effect from the vaccine right now?
Well, I think I'm going to let James respond to that. Okay.
So the question was related to the current case counts. A couple things. First of all, we're definitely not seeing any effect from the vaccine. A very, very, very small portion of the population has been vaccinated, and essentially zero has received the second dose. So it's going to take some time. But the question was really what's going on with the case counts. We had reduced testing over Christmas and New Year's because of the holidays. Almost all testing providers were closed for the holidays. So we expected to see a dip in case counts related to the reduction in testing. And we also don't expect to see cases show up on the dashboards for at least 10 days. 2 weeks has been more typical from when an event occurs. And that's been consistent throughout. And that's because it takes time, of course, for someone to test positive, and then it takes a little time for those results to come in and show up as well. So if you put all those pieces together, I think we're not going to get a good picture of what may have happened or not happened around the holidays and New Year's, probably until sometime next week.
So Beth, do you want to go ahead?
KQED, given the state's most recent health order, hospitals in Santa Clara County accepting 7 transfers of COVID-19 patients from other hospitals around the state, and county and hospital officials believe they can handle those transfers.
So the question's about the new state health order that was issued yesterday. This is an order addressing hospital surge. The state is mandating that hospitals that are basically in formal crisis care mode try to transfer patients out elsewhere in the state, and that hospitals that are not are mandated to try to accept those patients where possible. That will affect, of course, Santa Clara County as well as all other counties in the state of California. We're still learning more about how that'll exactly be operationalized, but it is dependent on the specific circumstances at each hospital as well as with respect to each individual patient. A patient transfer is an individualized determination, and so those will be made through the normal state mutual aid system.
Has county contact tracing uncovered the source of the outbreak at Kaiser, or if any patients have been infected?
So the question was about the source of the outbreak at Kaiser, and all I can say at this time is that's still under investigation.
What are some of the things the county is doing to help the hospitals prepare if this continues to rise? What are some of the practical things?
So the question is, what is the county doing to help the hospital prepare? So we have been working with the hospitals since before March to prepare for the scenario we are in right now. Specifically, we have helped them with procuring PPE, so that if you remember, back in the spring, there was a huge concern about PPE shortages. We are thankfully no longer in that state where we have actually been able to procure PPE, and the supply chains have stabilized. Secondly, we have also helped with hospitals in terms of preparing their surge plans, deciding how they will ramp down some services to make sure that they can accommodate the most critically ill patients. Thirdly, we have worked with them on distributing some novel treatments for COVID-19, including antibody treatments, including remdesivir, which have helped somewhat in their ability to treat patients. And fourthly, and the most challenging, is around staffing. And that's the one thing that has been really challenging throughout this pandemic. And we continue to work with them and with our state partners in order to try to secure staffing, because that's really the rate limiting step right now in how much the hospital are able to surge. And unfortunately, unlike PPE and unlike medicines, you can't manufacture staffing in a factory. There's a limited amount out there, and we're doing our best to try to draw what resources we can and share them equitably.
Question from Bay City News: is the shelter-in-place order going to be extended, or as of right now, does it expire on Friday?
So the question is, when does the stay-at-home order expire? The order is in place here in Santa Clara County through the state's regional stay-at-home order that currently it ends January 8th, but the state has made very clear that it will be extended if ICU capacity projections remain below 15%. The state has already extended it in Southern California and Central California, and we have every indication that it will be extended here in the Bay Area as well, because the hospitalization situation has not improved since it was issued.
Other question, when is the vaccine distribution big picture plan going to come out, even if it's not perfect?
So there's a question about vaccination distribution planning. The planning related to the vaccinations is happening in phases. So the Centers for Disease Control and Prevention has issued specific guidance breaking up eligible populations into different phases, 1A, 1B, 1C, 2. The state is developing guidance. They've already issued the guidance for phase 1A, which is what we're in, which is healthcare workers. And they're developing guidance with respect to the subsequent phases. We have to build our plans based on that directive from the state, and work is well underway to provide for that, including deep into phase 1B, 1C, and phase 2, which will be the general population. So it'll be some time since we're still in the early stages of phase 1A, but we very much know that many people in the community are eager to be vaccinated, and we are very eager to see vaccinations happen on a mass scale.
Let me respond to that one too. The board, both Supervisor Simidian and I have asked for both Supervisor Simidian and I have asked for a plan to come forward to the public, even if it's not perfect, just to respond to that point, and recognizing that if the more information that we can get out through all of you so that people understand the vaccines are on the way, when their turn will be, that we think it's going to help people feel more comfortable and confident about how long we're going to be suffering from COVID-19 as a community. The other thing I would just recommend is the staff has done a tremendous job of really pivoting with vaccines arriving and getting people vaccinated, and I think have done a really noble job. If you look around the country, we're a little bit ahead of everybody else, in part because we have such strong leadership from the county. That being said, on Tuesdays at our board meeting, they're always a time certain. There will be a discussion about vaccines and being able to get an update. So I would just recommend that at our Tuesday board meeting at 1 that you tune in and you'll learn more about where we are with vaccines. I'm going to let Dr. Kamal respond to that.
I know I have a few friends who come in from Alabama and Southern California. Are there plans to bring people?
The county and other hospitals in the county have been using staffing agencies, and these staffing agencies source from all over the country. So we currently do have nurses working in our county from all over the country. However, the competition for these resources is quite intense, and it's just a limited supply in general, but we certainly are looking throughout the country to try to get staffing. Yeah, the need is here right now, and so we certainly could use more nurses, and I think that we all know within California, Southern California has perhaps even a greater need right now, but there is also a state-level program of CalMat, which can help with resources as well, and we have been drawing down on that as well. But you are right in the sense that those resources do get allocated to great places of greatest need.
Right now for a bed at a county hospital once someone arrives at the ER?
I don't have that data with me. It's certainly something that the hospitals may be able to provide you. What I can tell you is that the wait time in the emergency room is directly proportional to what's happening outside of the emergency room. So when you have a hospital that's full and there are no beds available, that increases the wait time. So it's this continuum of care that starts, as Mr. Franklin said, from the EMS system to the emergency room, to the hospital, and then to discharge. And that entire system right now is strained from beginning to end. And that's really what's causing wait times in the emergency room to increase.
in regards to wait times that ambulances are seeing at hospitals, during the month of December, we actually have a report right now that's been posted up on the Santa Clara County EMS agency's website. You can actually get on there and see what the average wait time for each of our hospitals were based upon what the ambulances were experienced. But we've seen wait times anywhere between an additional 30 minutes, where we even had a case during the month of December, which it took 8 hours to offload one patient. So it's been fluctuating, obviously, based upon time of day and what the hospital is experiencing. Some patients, if they're a trauma, they might be getting in very quickly. Other patients with lower acuity, lesser non-life-threatening symptoms, they may be waiting for quite some time. There's also a common misconception that if you go to the emergency room by ambulance, that you're going to get seen quicker. And I want to dispel that because that's not the case. The hospitals will triage each patient that comes in, regardless if they're a walk-in or if they're brought in by ambulance, and then they're going to be treated based upon the acuity of the care that they need. So some of our patients we've been bringing in by ambulance have gone out to the waiting room. So just to make sure I dispel that.
Follow-up question? Yes. Of the calls that come into the 911 center, how many calls on a daily basis? And also, you mentioned earlier the push to get more people to think before they make that phone call.
Yes.
So what percentage would you say of the phone calls that come into the system are cases that can be handled by calling a primary care physician or going to an urgent care facility?
Great question. So we also have a report up on our agency website, which is open to the public. Anyone can get on there. It's called, you can actually see how many transports we have done each day based upon, and also how many ambulances are being sent to each hospital. To give you kind of a figure, our current cancellation rate is about 33%. So 1/3 of the calls that we respond to, we actually do not result in a transport, but that could be for a multitude of reasons. It could be that the patient elected to have a family member drive them to the hospital. It could be that the patient didn't call 911, someone else called 911 on their behalf, and they truly weren't experiencing any medical emergency. In the month of December, we were averaging about 230 transports every day in our 911 system. And then we're averaging about 350 to 400 911 requests each day in Santa Clara County. So just to give you some numbers. Anything else? All right.
All right, Robert, did you have one last one?
I don't know who this is for. Somebody asking me to ask this question, which is, you have workers who are working at several different hospitals because of staffing, et cetera. Is that going to continue given the current outbreak that we're seeing at Kaiser, St. Louis, et cetera?
So it is true that many workers do work at multiple sites. There's really no way around that given this tremendous staffing crisis we're in right now. We need all hands on deck. But clearly every place where a healthcare worker is employed needs to have a comprehensive infection control program, needs to do testing to keep both the workers and the patients safe.
Thank you, everyone. If folks need one-on-ones, people will hang out. Thank you for being here.
For the latest information regarding the COVID-19 pandemic in Cupertino, please visit cupertino.org/coronavirus.